Thank you for joining us. This morning, we're going to talk a little bit about what is affecting my drugs. And this will really be a further look at drug-to-drug interactions, as well as cannabis contaminations. I want to first acknowledge others who have helped put this presentation together. That includes Sean Cronin, Josue Cruz, and Lisa Padilla. Now, AzCANN is a cannabis education program that's delivered by the University of Arizona's Comprehensive Center for Pain and Addiction. The program is supported by a grant by the Arizona Department of Health Services, and the contents are solely the responsibility of the authors and do not necessarily represent the official views of the Arizona Department of Health Services. I also want to acknowledge Galen Dara for the wonderful images. No financial disclosures, so all content controllers of the training about to take place have no relevant financial relationships to any types of disclosures, so I really have no financial disclosures. I also want to respectfully acknowledge the University of Arizona is on land and territories of the indigenous people today. Arizona is home to 22 federally recognized tribes, with Tucson being home to the Oda Autumn and the Yaqui, committed to diversity and inclusion. The university strives to build sustainable relationships with their sovereign native nations and indigenous communities through education offerings, partnerships, and community service. All right, our outline. The introduction to cannabis legalization and the use in the U.S. Important to understand how many people are actually using cannabis. I also want to talk just a little bit about what is in the cannabis plant. I think there's a lot of speculation of, one or two things, but I really want to talk more about what might be in the plant. Talk a little bit about the metabolism of cannabis and drug-drug interactions, a very important topic this morning. And then also talk a little bit about some of the contaminations and contaminants that are found in cannabis. All right, so if we look briefly over the rules or federal regulations as well as the state regulations of cannabis, we know that federally today still cannabis is illegal. This is something that is still being looked at, and whether there can be changes from what we would call Schedule 1 to Schedule 3 at the federal level. However, the state of Arizona, like many states across the United States, have approved the medical use of marijuana. So in Arizona, it was in 2010. In which it was approved for medical use. Recreational use did come up in 2016, but it was rejected. I feel a very important law was passed in 2019 that many people are not aware of, but the state of Arizona actually required testing for potency and contamination, which, again, I really liked the idea that if we were going to use medical marijuana, that it should be tested both for its potencies, and that is really pertaining to THC potency, and the contaminants. In 2020, adult use cannabis was legalized, and this is recreational use with limits on the amount that you could get, as well as the amount of plants that could be grown. And of course, today there is the commercial model of cannabis and cannabis products for recreational use as well as for medical use. The current use of cannabis today and predicted uses for the future. I really want to talk about this because I feel that this is something that is growing very rapidly, the use of cannabis. Currently, 48 million Americans use cannabis. This is done on a survey poll, so it's about 18% of the population. But again, many people are still worried about admitting to using cannabis, so I feel that this number is probably underestimated, but it does demonstrate the fact that there is a large population that is using cannabis. If we look at compared to other products like alcohol or tobacco, we know that there's about 140 million people that are admitting to using alcohol, about 46 million using tobacco. But it's thought that cannabis in the last year has really increased, at least people acknowledging the use of it, has increased by 43%. And it's really the thing that is growing much faster than the use of alcohol. And as a matter of fact, tobacco use has been decreasing. Of course, there's still this vaping, in which also the vaping is involving some types of cannabis as well. Well, let's look at the predictions here. In 2030, it's thought that about 71 million, and maybe some places will have predicted close to 100 million people will be using cannabis. And if we look at it, 71 million Americans using it, that's 1 out of every 4 Americans. There's a pretty good prediction that at least 1 out of every 4, maybe even 1 out of every 3 Americans may be using some form of cannabis. Now, that might not be just smoking cannabis, but it may also be different creams or different edibles, and often being used for different medical, or at least toted medical therapies. If we look at cannabis and the amount of sales is another great way to sort of look at people using cannabis. Currently, the legal recreation medicinal use of cannabis is at about 17 to $20 billion, which again is getting close to the global opiate market. Now, this is global opiates, or even the craft beer at 27 billion. You can see that it's higher already than the amount of sales of things in the National Football League. So when you compare it to sort of how much money is being made in the National Football League, cannabis is outdoing it. But importantly, if you look at the top here, the idea that by 2026, which isn't too far off, it's thought to be at $52 billion in sales. And so again, it's rapidly increasing as far as use, and you can track it both by surveys or by sales. Now, switching gears a little bit, what are the products that are in the cannabis plant? And so when we look at cannabis and the cannabis plant, we know that there are over 500 different chemical constituents in this plant, suggesting the idea that it's not just THC or cannabidiol, but there are many different chemicals that are in this plant. And so when you start to look at it, we know that there are over 100 different types of cannabinoids. Okay, so THC is just one of the cannabinoids that are in there. We know there are terpenes, which actually gives it that distinctive smell, but many people are starting to investigate whether some of these terpenes could be helpful as well as harmful. Cannabidiol, of course, we've heard about that, and there are some studies on cannabidiol, but the majority of all the studies that are out there today in humans are really studies on delta-9 THC, or tetrahydrocannabinol. So 60 to 80% of all the research, it's done on just this molecule, and it's ignoring all these other things, these other 500 chemicals that may be in the plant, in which we don't know much about. Again, for both medicinal purposes, so we don't know if there's maybe some benefit. We also don't know these other chemicals may be producing other harmful issues. What's interesting is that the concentrations of THC, which we do know is the thing that does produce the euphoric effect, and we know that it's very active in the human brain, as well as the human body, it's gradually increased in the plants and in the edibles. So years ago, this is back in 1995, was thought to be about 4% of the content within a cannabis plant. Today, it's easily 15, and you can even see probably 20 to 24, 25%, maybe even higher. And this was, of course, back in 2018. But now, today, in 2024, this percentage is much higher. And I'm going to say that that's probably unfortunate, because we know that many of the issues and problems that do come from THC or come from cannabis use is due to the high concentrations of THC. So it's unfortunate that growers are increasing the amount of THC in their plants, as well as the amount of THC that's going into different edibles that really can start to cause some of the issues and problems that we're seeing from THC. What else is in there? Well, we do know there are other products besides delta-9 THC, which again is something that is very potent. It can have some benefits. Again, concentration dependent. So we know that at probably lower concentration, more is not always better. In other words, lower concentrations can be very helpful for things like pain and appetite, nausea. We do know this, and we do know there are some products that are delta-9 THC that are FDA approved for use for chemotherapy-induced nausea. But it can cause issues, and the more you use can cause more of these issues like anxiety and paranoia and nausea and other issues that can occur. We do know that delta-8 THC is also out there. This is just a slight change in, of course, where this little bond happens to occur. So if you'll notice, the delta-9 and delta-8 are really the same thing, just kind of a change in where a bond was. We do know that it's less potent, but it can produce the similar effects as delta-9. We also know there's a delta-10 THC that's out there. And again, it's just a change where the double bond will be. Some of these things with this change in the bond are thought to be less psychoactive. I think that is still to be debated, but they will suggest that it's less potent as compared to the delta-9. We do know CBD, which is a little bit of a different structure. This ring is opened up, And what's interesting about it, by just simply opening the ring on this molecule, you'll see that you become sort of a non-psychoactive. In other words, it doesn't have good activity at one of the cannabinoid receptors that produce the psychoactive components. So CBD, as we know, is a product. It's more concentrated in the hemp plant versus the cannabis sativas, typical marijuana type plant. Doesn't produce psychoactive effects, but it has been touted as being beneficial for things like insomnia and pain and reducing anxiety. And again, I think there just needs to be more studies to determine whether some of this is true. Terpenes, I just want to mention, like I said, there's a lot of different terpenes that are in the cannabis plant. Of course, it's what gives the cannabis plant sort of the smell. And many of us know that if you smell cannabis when it's actually being smoked, or even just the product itself, that smell is coming from terpenes. Now, terpenes are a class of natural products. Okay, they are this biosynthetic building block, and there's over 30,000 different types of terpenes. Not saying that all of those are in cannabis. There are a few that are in cannabis, but they can give that wonderful smell. And we all know conifers or pine trees. So there's a terpene called pinene, which is in the pine trees. It also happens to be at some concentrations in the cannabis plant and give a particular smell. And of course, this was all termed terpenes by one of the chemists. So August Kakul, he actually named terpene as a short term for turpentine. If anybody's ever smelled turpentine, that's all you're smelling is sort of that pine. A lot of turpentine pine is in that smell. They can be helpful. There are studies being done to determine the usefulness of different terpenes, including studies that are actually done here at the University of Arizona to determine the anti-inflammatory, reducing some of the pain, anxiolytic. So these compounds themselves, and it's a suggestion, the fact that you could actually combine a terpene maybe with a CBD, with a certain type of THC that may be actually very helpful. And those types of studies are ongoing to determine, could you use some of these products safely for things like osteoarthritis, liver fibrosis, anxiety, colitis. So you'll see there's a number of things that are listed here, but I want you to start to realize that it's not just about THC. There may be other products that may be useful in helping patients. At the same time, we are very conscious to make sure we study the harmful effects, not just to promote what they may be helpful for, but also to look to see if they're harmful, could they be addictive, and other types of issues. So that brings me to my first case. It's a primary case. And again, you will find many, many different cases out here. I like to sort of put the reference for this particular case on the screen, but there are many different references. But let's talk about a case here. This is a 56-year-old white male receiving chronic warfarin therapy for 11 years after mechanical heart valve replacement. Again, taking a drug that reduces platelet aggregation, right? So it's something that people would call a blood thinner, but it's trying to prevent any kind of heart attack or stroke. The patient smoked marijuana more frequently due to his depression, possibly due to some of the issues that he may be having here with his heart issues, but we don't always know this. He was admitted to the hospital with a diagnosis of upper GI bleeding. He had nose bleeding, increased bruising. His INR value was at a supra-therapeutic at 10, which normal, of course, we all know is 0.8 to 1.1. So obviously the first thing to sort of look at is the idea that he's taking a warfarin, right? And so we really are having an issue with clotting factors, which we know is how warfarin works. After treatment, he's discharged with an INR value of 1.1. So obviously something was done, probably something like giving vitamin K, which we know is trying to get the INR down back to a therapeutic range. What's going on here? Well, what other potential issues could have happened here, right? This patient could have had a stroke or internal bleeding, right? Especially if we have internal bleeding in the abdomen where we don't know where it's going, we have all kinds of problems, or especially up in the brain where there's this skull encased and you start bleeding and having swelling and having some serious issues, but obviously also lots of organ damage could have occurred. The patient decided to sort of stop smoking cannabis, of course, for 9 months. And when he did this, his INR value ranged from about 1 to 4.4 with no significant bleeding complications. Why am I using this case? The point of this case is to suggest the idea that I would like our group to know here in this particular CME event that warfarin, like many other drugs, may be having a drug-drug interaction with cannabis use. So it brings me to the idea that medications, of course, that are being taken, and it can be taken by the oral route or by other routes. In this case, we're talking about warfarin that he was put on. And of course, it can be taken orally and it gets absorbed in the body. And of course, we know that it has to be metabolized by enzymes, typically within the liver, maybe some other places. The liver's main job is to metabolize using things like cytochrome P450s. These are the enzymes that are in the liver. We know it metabolizes things like warfarin and many other medications that patients are taking, and then they're excreted from the body. And of course, knowing this process, you give a certain dose, knowing the fact that that dose that's given is going to go through this process and be excreted. And so we give not only a dose, but also a time frame. Take it evenings and mornings, so on and so forth. The problem here is, of course, is whether your patient's actually also taking cannabis. Now, the cytochrome P450s in the human body, and it gives you a number of different ones. With one of them, CYP3A45, and I guess it gives you these different numbers and letters, but the point here is CYP3A45 metabolizes anywhere from 30 to 40% of all medications. So that's a lot of medications. Now you can see we have other cytochrome P450s in different percentages, pointing out that 2C9 at 13% and 2C19 at 7%. So you can have other types of cytochrome P450s, but 3A45 is really the one that does a lot of different medications. THC, as well as CBD, and probably many of the other cannabinoids, are actually metabolized by those enzymes. CYP3A4, CYP3A4, you'll see here, also some 2C9 and 2C19, also important. But the idea here is that you need to know this, right? You need to know if patients are taking any type of cannabis products, and including CBD. Why? Because the levels of many medications can be significantly increased, as in my story with the increase in warfarin, due to cannabis products. Cannabinoid levels can also be increased. So they may think they're taking a little bit of CBD or cannabis, but they may be taking way more. So let me explain just using sort of a picture here. But I also wanted to just point out the idea that there are a number of different medications that all use that same enzyme, that 3A45. The benzodiazepines, heart meds, antibiotics, statins, birth control, antileptics, antifungals. So there's just many, many drugs that use that enzyme. And now I want you to make sure you understand that cannabis, THC, and CBD also use that enzyme. So here's my picture. How does it work? Let's say that patient who is taking warfarin. We know the warfarin goes in by a dose that was prescribed by his physician. It gets into circulation. Eventually, it's going to move through the liver because the liver, of course, has a high capacity for blood flow. And within the hepatocytes, the cells of the liver, you have enzymes like the cytochrome P450. In this case, I put 2C9. We know warfarin will bind to that enzyme. It becomes hydroxylated and it becomes excreted out of the body. And so, of course, you dose accordingly, knowing that this is going to happen, right? And so it will continue on until the warfarin is removed and another dose is given. However, if your patient also happens to be taking THC, well, THC also uses this enzyme. And so you can see that if the THC gets in there, instead of the warfarin, it prevents the warfarin from getting in, so the THC may be being excreted. And so this is a competition that continually goes on. Sometimes warfarin will be hydroxylated, sometimes THC. But what you can see, I hope, is that it slows down the removal of both things. And so you start to get an accumulation of warfarin within circulation, which can lead to bleeding. And you start to get an accumulation of THC, which may produce some of its more side effects, because now you realize that you may have almost doubled your dose of THC at the same time you're doubling your dose of warfarin. So the result is that you get increased side effects of both drugs. So not only can we affect medication levels, we can affect cannabinoid levels, but we can have additive effects. So knowing the fact that THC may affect your CNS and have psychotropic effects, there are other drugs that are also using these enzymes, antiemetics, analgesics, anti-anxiety. So this is an example where a person was only on one drug. What happens if they're on warfarin as well as maybe an antidepressant and they start taking THC? Well, now we have 3 drugs competing for those same enzymes, and we really can start to have sort of a huge potentiation that occurs. So this is really what we call this red flag interactions. And we can have multiple different drugs even affecting the brain and the functioning of the CNS. And so it's important to understand, again, that cannabis can produce drug-drug interactions with many different types of medications. The second issue that you may be aware of that's showing up in many of the operating rooms is the fact that cannabis use can really affect the anesthetics and hence surgery and a patient actually being able to be put under using an anesthetic. And so this has come out in multiple different studies and case reports in which the use of cannabis, even smoking it or edibles or creams, can really have an effect on the amount of anesthetic that is needed and how a person's body responds to anesthesia. So it can, again, may have to change the type of anesthetics that's used, of which maybe it's not preferred. It may have to be in the fact when a patient is used prior to surgery can really result in some complications that may occur. Cannabis use, of course, just prior to surgery may result in delays. The doctor may not feel comfortable if they know you've used a lot of cannabis the day before or even that morning because you're nervous or whatever. Patient may be nervous. And so there's really some huge complications that can occur. And that is something that really should be discussed between the patient and the physician and clinicians. All right. So what can clinicians do? Take a moment, sort of look through some of these. I'm going to read through these here. And what can you as clinicians do? Well, ask all patients about cannabis use and frequency of use and include it in electronic health records. Absolutely. Now, again, patients may feel uncomfortable, but it's important and a part of your responsibility to sort of say, in the state of Arizona, they are legal for medical use. And so it's like any other kind of medication, but it's important that we know this because of drug-drug interactions and surgery issues. Include advisory about or include advisory about cannabis use when prescribing new medications. So preparing for surgery. So if another drug is going to be added on and the person's using cannabis, there may have to be some adjustment in doses. Consider titration of proper dosing if patient is unable or unwilling to curb their cannabis use. D, of course, we don't want to do this. So we don't want to shame patients who are using cannabis because, of course, if they do that, they're not going to be forthcoming in the amount of cannabis that they're using. So we really want to think about A, B, and C, but we do not want to shame patients who are using cannabis, recreational or medicinally. We just want to know that information so that we can better treat our patients. All right, this brings me to our secondary case. This is a 29-year-old male professional in an urban area with type 1 diabetes. He presents to the emergency department with shortness of breath and chest pain, going on for about a week. Has felt generally unwell for the past year with fevers, night sweats, and weight loss. Patient is taking insulin and a pump inhibitor, so may have a little bit of gastroesophageal reflux disease, so he takes a pantoprazole. And he's been inhaling some marijuana that he's bought on the street for the past 18 months to relieve some of the neuropathic pain that's due to some of the diabetes. Well, upon physical exam, you see that the temperature is 36.6, heart rate is 80 beats per minute, respiration rate 18 breaths per minute, blood pressure at 125/85, oxygen saturation of 100%, room air, so good. But the respiratory exam showed that he had decreased air entry into the left lung base. And it actually gives you a nice image here, a little bit of some density there, a little bit of fogginess. There's things there, maybe some density and some black spots within there. So, and again, you can see maybe a little bit of the density here. But really, what we want to look at is the CT of the chest, which showed a left pneumothorax. And that's really this yellow air. So we get some air in here that we really shouldn't have. That's up against the sort of the left lung here. The left lower lobe has some consolidation with cavitation, likely communicating with the pleura. So we'd have some fluid, right? Again, not necessarily good. Pleura was just showing you the chest tube here, but obviously there's some issues going on here. Following on, so there's a thoracoscopy surgery performed, and here there's diffuse pleural adhesions that are found requiring a wedge resection of the superior segment of the left lower lobe. Tissue samples from the wedge resection, some grew, one of the Aspergillus rugulosa, which is a non-sporulating fungus. The patient's own pleural fluid also grew some Aspergillus fumigatus, which is another type of course, of this Aspergillus. The histopathological exam of the biopsy specimens even confirmed the parenchymal and pleural invasion. And so really this can be a serious issue for this patient. So what they asked then was to look at the patient's marijuana. And what they found was there was fungal cultures of several samples of the patient's marijuana that grew this Aspergillus. And so it was coming from the marijuana. And so, of course, the diagnosis was this chronic necrolizing pulmonary aspergillosis and a fungal epidema. And so, again, this is just one of many cases that you'll be able to find. You can look this one in particular up. The idea that cannabis products are not only producing potentials of drug-drug interactions, but they also can have a number of different contaminants. And so we all know there are a number of different headlines that have come out with suggesting the fact that cannabis can be tainted with many different things. This was back in 2022 from the Arizona Republic. We know that it's not just within the cannabis plants, if you're just looking at the buying those particular plants that may be smoked, but it also can be in edibles, and contaminations can be there. Again, it's hard to get regulations. There's no national FDA regulations. And so there are some regulations of testing that have been put in place by states, like I said, in Arizona, but it's very difficult to test all of the products. This was an ad that came out in the Wall Street Journal. This is Ann Hassel, where she started having all kinds of problems. Her feet went numb, muscles twitched, felt nausea, using marijuana, and she actually worked in a dispensary, suggesting the fact that marijuana, there's no guarantee of safety. Marijuana has showed mold, pesticides, heavy metals, all kinds of contaminants that can produce sickness and serious issues. And you'll see different advertisements, Forbes and NPR, all talking about the need for more regulators to really, again, the use is increasing, 43%, 1 out of 4 people using it, but we just don't have good regulations on some of the contaminants. What could be in there? Well, there are a number of environmental contaminants that are present in cannabis. There are pesticides, fungicides, herbicides, mites and mildew. This is just a picture taken here where you can see now the mites. Of course, it's microscopic. They're hard to see by the native eye without using something that would increase our ability to be able to see them. But you can begin to start to see mildew on them. You can sometimes see fungus. Many of the extracts that come out of plants that are used for edibles or creams may involve solvents, because they're extracting this out of the plants. And so there's all kinds of solvents that could be in there and metals that may be very neurotoxic just based on the extraction process. Again, there are fungal and mycotoxins that are present. So this was a study a while back now in 2016. You can see many more of these studies in which, again, people who are smoking cannabis are more likely, 3.5 times more likely to develop some kind of fungal infection. Again, there's that Aspergillus that can account for 43% of people using cannabis. That obviously I gave you a case report in which is probably more common than we think, producing some of the lung issues. You will see if you start to look up the different toxicities of Aspergillus or different types of mycotoxins, and it can affect, obviously, surgeries, can affect the lungs, hepatic cancer, vomiting, nausea, renal toxicity, all kinds of things that are beginning to show up due to these types of fungal and mycotoxin infections that are occurring due to using cannabis products. Examples of people who are really susceptible, so not suggesting that everybody is susceptible to this, but obviously patients who are cancer patients, and especially if they're receiving chemotherapeutic agents, which really are immunosuppressive type agents, HIV/AIDS patients, transplant patients, diabetes patients, COVID patients, but there are many people that we are finding being infected by and having lots of serious health issues due to fungal and mycotoxin contaminants in cannabis. Okay, finally, I just want to switch gears. Just the last here is to talk about product reliability. Again, because there are no FDA regulations on these products, and there are a number of different products out there. I wanted to share with you studies. This was an interesting study looking at cannabidiol. Again, many people will think, well, cannabidiol is a little bit more safe, which I'm not going to say it's not. There's a product, a cannabidiol product called Epidiolex that has been approved by the FDA for seizures. Typically, these are some seizures that often can be found, unfortunately, in children. But this particular authors of this paper really decided to say, hey, there's a lot of this stuff being sold online. Okay, so not just Epidiolex that's coming from the company, which we know is a good product and is regulated by the FDA, and we know what's actually in there. There are a lot of cannabidiol products that are sold online. And so this group actually went and bought 84 different types of cannabidiol. Again, they purchased them through the internet, and they sent these products to different labs across the United States listed here to have them tested to see if their product that they were selling matched what was on the label. And they said there were a lot of products that were mislabeled, 26% containing less CBD, some containing more, some containing THC, some containing other different types of contaminants and products. And so the take-home message is that the CBD that were in the products on the label was not matching. There was also another study in which some CBD vapes containing street types of drugs. So this was commissioned by laboratory, the actual floor research laboratories, in which, again, they took these products that were being sold and they went to sort of say what is in these products. And 10 of the 30 contain different types of synthetic marijuanas. Many of the things that we know as sort of this K2 or spice were found in some of these things. Some of them even didn't even have any CBD in them. Unfortunately, some of them even found fentanyl, which we know is, of course, that powerful opiate, which has been many, many deaths, unfortunately, due to this, was actually found in some of these vape products. And so the head, of course, of the director of Flora Research, Dr. James Neal Quebec, actually stated the fact that this is like Russian roulette right now. And unfortunately, many of the teenagers are purchasing some of these vapes and using these things. All right, so in summary, let's take a moment and sort of go through some of these fantastic things that we sort of talked about today. We know that cannabis use is on the rise, and there are many unknown things about cannabis is the first thing to sort of put across, that people are using it, but there's lots of unknowns. I want you to realize that there are many different chemical components in cannabis that may be helpful therapeutically, but also may be harmful. And there really needs to be a lot more research done to sort of determine what is helpful and what is harmful. Cannabis will alter serum levels of many other medications. If there's anything as a take-home message, please take this one, and the fact that using cannabis will alter medications, prescribed medications, over-counter medications, and it can result in some dangerous situations. Medications also alter levels of THC. So if a person thinks they're taking a small amount of THC and they have 2 or 3 other medications on board, well, they're actually probably taking more THC because it's accumulating within the body. And it can cause some severe issues. Cannabis can have multiple different contaminants. So we've talked about all the different types of contaminants that are being found in cannabis, and it can result in a number of unwanted and dangerous effects. And of course, be very careful and, again, informing your patient population that these cannabis products that are being sold online or even in the farmers markets don't necessarily represent what are the substances that are actually in the product that they're buying. So all of these really are true things and should be considered. So in conclusion, the clinician, physician, be sure to ask your patients, are they using cannabis products? Make them feel comfortable with telling the truth and the fact that, yes, it is legal, medicinal use and recreational use, and important that I know that you're using cannabis because it may affect other medications. As someone who uses cannabis products, if you're listening to this, be sure to tell your physician and clinician that you do use cannabis products to make sure that they can regulate the other types of medications that you may be using. Be sure to use reputable licensed sellers of cannabis products and tested products. This is not always easy to find, but at least try to due diligence. I wouldn't buy just any type of cannabis on the street because it may have many of those different types of contaminants that are going to make you sick. So at least try to use reputable licensed sellers. Like I said, the state of Arizona in 2019 approved and made a law to test ones that are coming from the different dispensaries. They can't test all the products, but there is random testing to try to determine both what is on the label is accurate as well as whether there are contaminants. And finally, I just want to end with the idea that there is a huge need for more education and research into cannabis so that we can, of course, protect patients, learn more of what may be helpful, but also to learn what may be harmful. And so with that, I want to thank you all for participating and listening in. I want to make sure that you understand that if there's more information you'd like, you can use this QR code to get more information and the things that we do at the Comprehensive Center for Pain and Addiction. Our email is here, website is here, QR code's there. If you want to be more involved in this area, educating, doing research, just being a part of the center, please reach out and contact us. It is a growing group. We have probably over 50 to 60 people participating in all different avenues of our center, looking at new research for pain and addiction, as well as cannabis and cannabis education. Thank you.